What if the most dangerous person in the room was not the disease? What if it was the healer? Not because he was cruel, not because he was careless, not because he wanted you to suffer, but because he was completely certain that the thing hurting you was the thing saving you. Imagine lying in bed with your throat swollen, your skin hot, your breathing shallow. Your family is terrified. A physician arrives. He carries tools, bottles, powders, and the confidence of centuries. He looks at you, feels your pulse, listens to your breathing, and decides that your body must be corrected. Then he opens a vein. The blood runs into a bowl. At first, everyone watches in silence. Then you grow weaker. Your face loses color. Your hands turn cold. But the physician does not panic. In his mind, this is not a warning sign. This is treatment. For most of human history, the most frightening part of getting sick was not only the illness, it was what people might do to cure it. Today, we expect medicine to be on our side. We expect a pill to have been tested, a diagnosis to have evidence behind it, a doctor to understand at least something about what is happening beneath the skin. We complain when a prescription takes too long, when a side effect is annoying, when recovery takes weeks instead of days. That expectation is very new. For centuries, a sick person entered a world where treatment could mean bleeding, purging, burning, poisoning, starving, or forcing the body through violent pain. The people doing this were not always frauds. Many were educated. Many were sincere. Many were respected. They believed they were helping. That is what makes the history so disturbing. The tragedy was not just ignorance. Ignorance can be honest. The tragedy was confidence built on the wrong map of the body. A healer could look at a dying patient, repeat a dangerous treatment, watch the patient weaken, and still believe the cure had failed only because it had not been strong enough. And for a long time, there was no reliable way to prove him wrong. To understand how this happened, you have to remove almost everything you know about illness. Forget bacteria, forget viruses, forget cells, immune systems, blood tests, antibiotics, anesthesia, clinical trials, and microscopes. Imagine being a physician 500 years ago, standing beside a person who is shaking with fever and gasping for air. You cannot see infection. You cannot measure oxygen. You cannot culture bacteria. You cannot open a textbook and find a clean explanation. All you have is tradition, authority, observation, and memory. And memory is dangerous because you have seen sick people recover after being bled. You have seen sick people recover after drinking bitter herbs. You have seen sick people recover after vomiting for hours or after being purged until they were empty and exhausted. So you believe the treatment worked. What you cannot see is the other possibility. The body may have recovered in spite of the treatment, not because of it. That single difference between healing because of medicine and healing while medicine happened nearby took humanity centuries to untangle. For much of Western medical history, the dominant explanation for illness came from the theory of the four humors. The body was believed to contain four essential fluids: blood, phlegm, yellow bile, and black bile. Health meant balance. Disease meant imbalance. A fever, a cough, a swelling, a strange sadness, a sudden weakness. All of it could be interpreted as a sign that something inside the body had become too abundant, too stagnant, too hot, too cold, too dry, or too wet. This was not a strange belief held only by village healers. It was taught. It was written down. It was repeated in universities. It shaped medicine for generations. Kings, soldiers, merchants, mothers, and children all lived under its logic. If the body had too much blood, the answer seemed obvious: remove blood. Physicians and surgeons opened veins with lancets. Leeches were placed on the skin. Cups were heated and pressed against the body to draw blood toward the surface. Sometimes the amount removed was small. Sometimes it was terrifying. And if the patient got worse, the theory could protect itself. Maybe the bleeding had come too late. Maybe the wrong vein had been opened. Maybe the disease was stronger than expected. Maybe the patient's constitution was too weak. The treatment did not have to be blamed. The patient could carry the blame instead. In December of 1799, George Washington became one of the most famous examples of how dangerous that certainty could be. He developed a severe throat illness after riding in cold, wet weather. His condition worsened quickly. His breathing became difficult. His physicians did what educated physicians of the time often did. They bled him, again and again. By some modern accounts, more than 80 ounces of blood were removed from his body in less than a day, roughly 40% of his total blood volume. Washington was already dangerously ill. We cannot know with certainty what would have happened without the treatment, but that much blood loss would place enormous stress on any body, especially one already fighting for air. He died that night. The story is often remembered because he was George Washington, but the truly frightening part is that the logic used on him was not unusual. It was ordinary medicine. It was practiced with seriousness, with training, and with the approval of the medical world around him. The most powerful man in America could still become helpless once the wrong idea entered the sick room. Bloodletting was only one part of the larger world of pre-modern treatment. Another was poison, not poison offered secretly, not poison used as murder, poison offered as care. Mercury became one of the most infamous examples. For centuries, it was used against syphilis, a disease that terrified Europe after it appeared in epidemic form in the late 15th century. Patients were rubbed with mercury ointments. They swallowed mercury compounds. Some were exposed to mercury vapors. Treatments could last weeks, months, or longer. The side effects were brutal. Mouths ulcerated. Gums swelled and rotted. Teeth loosened. Skin broke down. The nervous system could be damaged. Kidneys could fail. Some patients trembled. Some became confused. Some died from the treatment itself. To a modern viewer, that sounds like obvious poisoning. To many physicians of the time, it looked like the disease being forced out. Salivation, sweating, sores, pain, these could be read as signs that the body was expelling corruption. The more the patient suffered, the more the physician could believe the medicine was acting. That is a terrifying idea. Pain not as a warning, but as proof. Some patients with syphilis did appear to improve after mercury treatment. That made the belief even harder to break. Syphilis can move through phases. Symptoms may fade for a time, even when the infection remains in the body. A physician watching only the surface could see ulcers disappear, fever calm down, or visible signs retreat, and conclude that mercury had done its work. In some cases, the patient's own immune response may have played a role. In other cases, the disease may simply have entered a quieter stage. But without modern testing, the distinction was almost impossible to see. The medicine could take credit for what time had done, and when the patient suffered, the explanation was ready. The cure was difficult because the disease was deep. This pattern appears again and again in medical history. A treatment is introduced. Some people improve, some people worsen, some die. But without controlled evidence, without comparison groups, without a way to separate the natural course of illness from the effect of the treatment, almost any outcome can be made to fit the theory. Survival confirms it. Suffering confirms it. Death can confirm it too, if the theory is protected tightly enough. The same logic shaped countless other remedies. Medical recipes across history included ingredients that now seem horrifying or absurd. Animal substances, rotting materials, crushed creatures, opium mixtures, minerals, purges, fumes, and burning agents placed on the skin. In ancient Egypt, some medical recipes included substances modern readers would consider dangerous or unclean, including animal excrement. In parts of medieval and early modern Europe, theriac was treated as a powerful remedy against poison, plague, and many other threats. It could contain dozens of ingredients, including viper flesh and opium. These remedies were not always random. They often followed a logic. If disease was thought to be caused by corruption, foul substances might drive it out. If poison threatened the body, a complex antidote might protect it. If illness was trapped inside, the skin could be blistered to draw it outward. If the body seemed overloaded, vomiting or diarrhea could be induced to empty it. The internal logic could be coherent. The problem was that the body did not obey that logic, and the body was the only thing that mattered. One of the cruelest parts of this world was that failure rarely shattered the belief system. A patient could be bled until he fainted. If he died, the disease had been too advanced. A woman could be purged until she collapsed. If she worsened, her constitution had been too fragile. A child could be given a harsh compound that caused violent pain. If the child did not recover, the illness had been stronger than the remedy. The framework survived because it always had somewhere to hide. That is not only a medical problem, it is a human problem. When people inherit a system that explains everything, they can stop noticing when it explains nothing. Every result becomes evidence. Every failure becomes an exception. Every dead patient becomes another reason to act earlier, harder, more aggressively next time. This is where the story becomes more than a list of strange cures. It becomes a story about how certainty can become dangerous when it is protected from correction. The healer walks away with the theory intact. The patient does not walk away at all. Now imagine being the patient, not a king, not a famous general, just a person in a room with a fever that will not break. You do not know what bacteria are. You do not know what inflammation is. You do not know whether your body needs rest, fluids, time, surgery, or nothing at all. You only know that you are frightened and that someone with authority has arrived. He tells you the treatment will hurt. You believe him. He tells you the pain means it is working. You believe that too. Soon, you are too weak to stand. Your stomach twists from a drug meant to purge you. Your skin burns where a blister has been raised deliberately. Your mouth tastes like metal. Your family watches because they have no better answer either. No one in the room is trying to be cruel. That may be the most unsettling part. The suffering is organized. It has language around it. It has tradition behind it. It has the calm voice of a professional telling you that this is necessary. And when you are desperate enough, almost any certainty feels like mercy. The escape from this world did not come all at once. It came slowly, unevenly, and with resistance from the very people who should have welcomed it. As medicine moved into the 19th century, some physicians began to question whether the old treatments were helping as much as people claimed. Statistics began to matter more. Comparisons began to matter more. Hospitals, military records, and public health observations made it harder to rely only on individual stories. But old medicine did not simply surrender. Bloodletting, purging, blistering, and Mercury had reputations. They had defenders. They had generations of authority behind them. To question them was not just to question a technique. It was to question the identity of the physician. And few things make people more defensive than evidence that threatens who they believe they are. Ignaz Semmelweis discovered this in one of the most tragic episodes in medical history. Semmelweis was a Hungarian physician working in Vienna in the 1840s. He noticed something horrifying. Women giving birth in one clinic were dying from childbed fever at much higher rates than women in another clinic. The difference was not random. The dead were often in the ward, staffed by doctors and medical students, who sometimes came directly from autopsies to deliveries. Semmelweis suspected that something was being carried on their hands. He did not yet have germ theory in the modern sense, but he introduced hand washing with a chlorinated lime solution. The death rate dropped sharply. To us, that sounds like a turning point that should have been celebrated. Instead, many colleagues resisted him. The idea was unbearable. Doctors were supposed to save mothers, not carry death from the dissecting room to the delivery bed. Even when the numbers improved, the implication was too humiliating for many to accept. Semmelweis became increasingly isolated. He was eventually committed to an asylum, and he died shortly afterward, likely from an infection after injuries sustained there. The man who saw that doctors could carry death on their hands died before the world was ready to listen. That is the haunting pattern beneath this entire history. People were not always wrong because they were stupid. They were often wrong because they were certain. They had inherited explanations that felt complete. They had seen enough apparent successes to feel reassured. They had authority, language, ritual, and social trust. They had patients who needed answers and families who wanted someone to do something. Doing nothing felt like abandonment. Doing something, even something harmful, could feel like care. That impulse is deeply human. When someone is suffering in front of us, action feels moral. Intervention feels compassionate. The harder the treatment, the easier it can be to believe it must be powerful. But medicine had to learn one of the hardest lessons in human history. A treatment is not good because it is intense. A treatment is not true because it is old. A treatment is not effective because people believe in it. And suffering is not evidence that healing is happening. Modern medicine is not the same world. That needs to be said clearly. The difference between a physician in 1750 and a physician today is enormous. Germ theory, anesthesia, antisepsis, antibiotics, imaging, laboratory testing, vaccines, and clinical trials change the relationship between illness and treatment. Millions of people are alive because medicine learned to test itself against reality. But the human mind did not change as much as the tools did. We still trust confident people. We still prefer action to uncertainty. We still feel safer when someone gives us a clear explanation, even when the truth is complicated. We still protect beliefs that are tied to our identity. We still mistake intensity for effectiveness. That is why this history matters. It is not only a story about blood, Mercury, and dirty hands. It is a warning about certainty. Every generation believes it is finally seeing clearly. Every generation looks backward and wonders how anyone could have believed such dangerous things. And every generation is tempted to imagine that its own blind spots are small. They never are. The people in this story did not think they were living in the dark ages of medicine. They thought they were practicing medicine. They thought they were applying knowledge, training, experience, and care. They stood beside beds. They listened to breathing. They watched pain. They made decisions with the tools their world had given them. Sometimes those tools helped. Sometimes they did nothing. And sometimes they killed the person everyone was trying to save. That is the part worth remembering. The past is not frightening because people were foolish. It is frightening because they were human in ways we still recognize. They wanted certainty. They wanted control. They wanted suffering to mean something. They wanted the cure to be worth the pain. So do we. 100 years from now, some part of our confidence may look different to the people who come after us. Some assumption may seem crude. Some treatment may seem too aggressive, too incomplete, too certain for what we actually knew. We cannot know which part yet, and that is exactly why the question matters. Not what were they wrong about? What are we wrong about while feeling completely sure?